Hey guys, I'm Kate, Plastic Free Mermaid, and we're here at Unwrapped conference put on by Upstream Solutions, and I'm here with Dr. Leo Trasande.
Hi.
Physician at NYU and also author of Sicker, Fatter, Poorer.
Yep.
Can you give us a little summary about what you talked about in terms of the impacts on children's health?
The reality is that healthcare providers get very little training in environmental health. I had the privilege of working with the American Academy of Pediatrics about a year and a half ago to document the health effects of chemicals intentionally or unintentionally added to foods through a variety of processes. There were three categories of chemicals that I focused on in today's presentation. One were the phthalates.
Yep.
They make plastic soft for all sorts of food packaging. And in particular, the evidence around phthalates and other chemicals like bisphenols, which are used in aluminum cans, are to make kids and all of us literally fatter. So bisphenol A, for example, makes fat cells bigger, disrupts the function of a protein that protects the heart called adiponectin, and it's a synthetic estrogen, and so can have sex-specific effects on body mass. There are studies that have documented that the higher the levels of bisphenols in children's urine and also mom's urines are associated with a higher chance that the child will go on to be obese. We work so hard as pediatricians and healthcare providers to get people to improve their diet, have a healthier lifestyle. And it's hard to even implement those changes at a family level, let alone sustain them. Whereas if you change manufacturing practices or even make some safe and simple steps to limit these exposures, you can have huge impacts and take the pressure off of families and healthcare providers to give them a third way to combat this rising epidemic.
And how does this report arm them to be able to lobby for their children?
Like avoiding microwaving plastic,
Okay.
which leaches these chemicals into foods and into our body. Avoiding machine dishwashing plastics, same reason. The heat and the harsh chemicals wash away some of the protective barriers and ultimately facilitate absorption into food. So there are certain plastics to avoid altogether. The numbers 3, 6, and 7 are the ones to avoid across the board. 3 are for the phthalates, 6 is for styrene, a known carcinogen, and 7 are for those bisphenols that we talked about also in the context of canned foods.
Can you give us examples of each of those types of plastic?
Typically, the PVC plastic is the plastic that's used for very flexible materials. It's used in a lot of what they call vinyl, if you will. And so that very tight wrap essentially was great from the perspective of manufacturing, but not great from the perspective of the human body. It also, these chemicals particularly shift how calories in the body are processed, literally making us, rather than have a good protein meal go into muscle, they shift into carbohydrates and fat ultimately.
Wow.
Yeah.
How does it do that? Why does the body do this?
It changes how certain genes are expressed without changing the genetic code that are key for lipid and carbohydrate metabolism. Just to use another example on how these chemicals literally hack our hormones. These Teflon-like chemicals used in all sorts of non-stick packaging called PFAS, or forever chemicals. And these chemicals in one study were associated with weight gain among folks who fought to get their diet and physical activity in line and lost weight. And they measured the PFAS levels in their serum, and the higher the PFAS levels, the more they gained that weight back. And then when they looked further, these levels were associated with slowing of the metabolism. Therefore, this is an opportunity to really think about, in a broader way, all the potential contributors to the obesity epidemic. Yes, diet and physical activity are key. You need to stick to that. But there are other factors that may also be interfering in our best efforts to lose weight.
I mean, sigh of relief? I don't know if I'm really breathing a sigh of relief. How do we avoid these things? I mean, that maybe explains it a little bit more. But it doesn't make me feel relieved.
Well, avoiding non-stick cooking materials is one way. Stainless steel and cast iron don't have those same concerns. Avoiding canned food is a great way to avoid bisphenol exposures. There's been a lot of attention to BPA-free cans. But the reality is that we're dealing with a lot of BPS, BPF, BPP, BPZ, just to name a few.
BPAF, I mean.
Exactly. BPS is as estrogenic and as toxic to embryos. So we're literally repeating the history of BPA with BPA-free. And that's why it's important to avoid canned foods across the board.
And is it kind of like if it says BPA-free, it probably has some sort of bisphenol?
Unfortunately, yes. There's some companies that went all the way and replaced it with something completely different, but Unfortunately, those are few and far between.
Something completely different but still unknown to you, the consumer.
The call to action here is that we have a ton of power with our pocketbooks, wallets, and purses. Think back to BPA and getting it banned from baby bottles and sippy cups.
Right.
That wasn't science. That was actually consumer attention and media attention that had the companies running to the FDA after they changed their manufacturing practices, after they had swapped stuff out, and they insisted on the ban.
Weren't there like thousands of studies around bisphenol or BPA?
There were some, but there was still a lot of inconsistency in the science back then. It's much stronger now, but the reality was that it wasn't the science that was moving the needle. Study after study was piling up, and the FDA was more or less putting its hands behind their back and saying we need more data and more information. But then when the media got on this and the public really got enraged, that really facilitated the change that we all seek. More recently, with the perfluoroalkyl substances, these Teflon-like chemicals, PFAS, that you find in these buffet-style food packaging, it took a study of 5 food packages, just 5, and 2 major supermarket chains. You saw it on Instagram and Facebook. And literally shoving aside their old packaging, calling up their upstream provider and saying, no, we need to change this now because our buyers are insisting on the change we seek. And literally they got it out.
So petitions, talking to the managers of the stores or the places that you shop, anything else that you encourage people to do to get active?
There's a role for policy here. Don't get me wrong. And we're seeing a lot of action on the state level to really accelerate this going forward. If we keep that pressure on, we've got a chance to eventually put together a domino effect where the companies will eventually come to the negotiating table and insist on federal policy, even in the current regulatory landscape.
I feel like this is exciting. Where can people find out more?
So I've got a website called sickerfatterpoorer.com, title of the book, or leotrasande.com. I'm on Twitter and Instagram at Leo Trasande as well.
Cool. Thank you so much, Leo.
My pleasure. Thank you.
Thanks for explaining it in an easy to understand way. Thanks, you guys. Definitely subscribe to check out more interviews from the Unwrapped conference, and have a great day.